As we still come to terms with what happened here, few of us can even begin to understand why gunman Adam Lanza would kill so many innocent children. But many point to mental illness as a possible answer.
I wish he was receiving some help.
Social worker Michelle Gleason believes part of the reason people suffering from a psychological disorder don't seek that help is because they don't view it as a real disease.
There is stigma around accessing mental health services and having mental health issues.
That's especially true for men, who are 4 times more likely to commit suicide than women.
They are not supposed to have emotions or appear as weak.
Strict gender roles often dictate how we cope with our problems, and that might also play a role in who is pulling the trigger.
When you can't reach out for help, you have a really hard time working through anger and feelings that are going on inside. So we need to give men permission to ask for help and not demean them for that.
Education is key. As a society, we need to know the warning signs and what services are out there. Treatment is covered by insurance under the Mental Health Parity Act, and our community's caretakers are there to help you find what works for you.
What we'll do is evaluate to see if they have a mental illness and if currently they're a threat to themselves or others. If that's the case, we're allowed to transport on what's called an emergency detention. It's a 72-hour hold, and that's done at the healthcare center, the crisis center down there.
In 2011, of the 50,000 calls that came into Wausau Police, just 650 were mental health related. But of those, almost half resulted in an emergency detention. So those welfare checks can really help save lives.